This is the case of an 18-year-old patient that presented to the emergency department with leg pain. On initial radiographs, a loosened lesion was seen within the proximal tibia. That prompted a CT scan. Coronal reconstructions of the CT scan show a well-defined loosened lesion within the proximal tibial metaphysis. Please note that although the borders are well-defined, they are thick and sclerotic. In fact, as you move away from the lesion, the sclerotic borders become less prominent. This would be considered an intermediate lesion in terms of aggressiveness. A non-aggressive, non-vascular lesion would show very well-defined but very thin sclerotic borders. At the other end of the spectrum, an aggressive lesion will show ill-defined borders with no sclerosis. This is a subacute osteomyelitis, also known as Brodie's abscess. Brodie's abscess has a very characteristic MRI findings. These are coronal T1 fat-suppressed post-gadolinium and T1 weighted images without fat suppression. What is characteristic in MRI of Brodie's abscess is the 4 rings or 4 levels. The first level of the first ring, central aspect of the lesion, shows low T1 and high T2 signal intensity with no enhancement and is related to pus and necrotic tissue. The second level or second ring is a region of thin, high T1, low T2 and enhancing region related to granulation tissue, and this is called the penumbra sign. The penumbra sign is characteristic for subacute osteomyelitis. The third level or third ring is a thin line of low T1 and low T2 signal intensity with no enhancement, representing sclerosis and fibrosis. And the last level 4 and ring is reactive edema about the lesion. These 4 levels are rings are characteristics for Brodie's abscess, but the most characteristic finding is the penumbra sign, which is level 2 of that thin granulation tissue that enhances. Subacute osteomyelitis or Brodie's abscess is a loosened lesion with thick sclerotic borders, which suggests intermediate behavior in terms of aggressiveness. In MRI, it has 4 layers from center to periphery, and the most specific for Brodie's abscess is the level 2 or penumbra sign.